I'm Paolo Cassano, and I'm going to talk about transcranial photobiomodulation for ASD, time for synchrony between biotech, pharma, venture, and academia. I want to thank the organizer of the Brain and Foundation for putting together this symposium, and of course, Anita Solmarsh. These are my disclosures. I'm the co-founder of a company in the light therapeutic space. I had the good fortune at MGH to work with the Bresler Clinical Research Program for Autism Spectrum Disorder, and the data I'll be presenting today are their data. In psychiatry, as in all medicine, it is imperative to treat psychiatric disorders as early as possible, before they become chronic and untreatable. This is a quote from Joe Biederman, the director of the Bresler Center for ASD at MGH. If I can paraphrase this quote, we cannot wait until disorders are metastatic to treat them. We need to treat early. This is a map of the spatial distribution of the risk for ASD diagnosis by age 6 based on home address. As you can tell, that varies north to south, and in the southern eastern state, below the line that you see drawn in this graph, the prevalence is significantly lower, or the risk is significantly lower for the diagnosis of ASD. If you compare that with the climate map, you see a striking correspondence, which might imply potential effect of sunlight. Of course, there are other factors. There is a potential bias in terms of diagnosing ASD. There is an intrinsic heritability of this disorder. However, we wonder about the environmental factors that contribute to the expression of those traits and symptoms of ASD. Now, this is not the first time that a potential correlation between light exposure and ASD expression has been considered. As a matter of fact, vitamin D and deficiency of vitamin D has been correlated with risk of ASD and greater symptomatology. And vitamin D is also being considered as a potential supplementation to prevent and potentially treat ASD. However, in the field of light therapy, a new interest has been drawn towards red and infrared light. And as a matter of fact, 30% of sunlight is near-infrared light at ground level. Near-infrared light and red light are absorbed by the cell at the level of the mitochondria, and they lead to greater energy in the cell, but also not only a pro-metabolic effect, but also an effect on transcription factors, with a cascade of effects which are anti-inflammatory, antioxidant, and pro-neuroplasticity. Now, what's the connection with the ASD? Well, while only a small portion of ASD cases are associated with proper mitochondrial disease, which is associated with abnormal phosphorylation and respiratory chain, there is a vast overlap in between mitochondrial dysfunction, or what we call here a non-classical mitochondrial disease, and autism spectrum disorders. So therefore, if there is a dysfunction at the level of mitochondria, you can see there is a potential rationale for trying this type of intervention. So we took that question, and our group on photobiomodulation partnered with the Bressler group for ASD. And we embarked in a pilot study in adults with high-functioning ASD at MGH. So this type of intervention is called transcranial photobiomodulation, in which is shedding either red or near-infrared or both light on the head. It's non-invasive, it's non-ionizing, it's a low-energy light. Of course, it's not pills as usual, and we demonstrated that there is a low attrition, so people are likely to stick with it and like the treatment. So we wanted to see whether there was effect, both in terms of reducing ASD symptoms and also wanted to consider safety in this population. Attila Serranoglu pioneered and led this study at MGH. Here you see the device that we used on the side, and you see that the site of light shedding was on the forehead. We had 10 subjects that were then included in the final analysis. This was an open pilot, and the treatments were twice a week for 8 weeks. Here's a schematic, and the wavelength was 830. The parameters were already validated in different populations at MGH and found to be effective already in other psychiatric populations. At baseline, the subjects were predominantly white males, and the average age was 30. There were comorbidities, high comorbidity or ADHD in this population, and also for mood disorders, which is not unusual. In terms of treatment, concomitant therapies, on average, these patients had 2 or more medications, mostly stimulants, but also half of the subjects had antidepressant SSRIs, and half of the subjects were treated with antipsychotics. When we look at the effect over 8 weeks of treatment with the composite score called SRS-2, we notice a striking change. There were certainly few non-responders, but on average, there was an impressive change with the decrease in autism spectrum symptomatology. We also looked at the subscales, and we found that indeed the effects were across different dimensions: social communication, restrictive interest and repetitive behaviors, also social motivation, social cognition, social awareness, all showed improvements with decrease in severity of impairment. The clinical global impression, also a different scale, showed similar finding with improvement in social interaction, social communication, and mannerism. These were the percentages in parentheses of the study subjects that were considered responders within those dimensions. Finally, safety and tolerability was definitely well tolerated, and we had only 1 patient who complained of insomnia, 1 that complained of headaches, and 1 that complained about warmth at the treatment side. However, all these side effects were short-lasting. So these were indeed very promising results, which left us wondering, what about children? This, after all, is a neurodevelopmental condition. So can we bring this to children? And what do we know about it? So part of this question is really about what is the expected penetration of the light. And together with Northeastern University, and this is a study championed by Yao-Shen Huan, we looked at the effect in modeling of shedding the light across different ages. And here is the representation of an 85, 89-year-old. You see the red spot where the light shed on the forehead is concentrating with a high absorption on the most superficial tissues. But as we go at younger age, middle age, you can see that there's more light shed over the brain, and even more so at a 5-year-old. And so this was very promising and demonstrated, if anything, that there is a great applicability of a transcranial near-infrared light or photobiomodulation in children and adolescents. And if anything, there is even better chance of treatment efficacy. Interestingly, about 4 years ago, a mother reached out to Marnie Nazer. She was the mother of 2 autistic children. And out of desperation and trying to do all what she could, she had contacted a local doctor and had arranged for laser treatment, even at home, to her own children with transcranial photobiomodulation. And she shared this experience with Marnie Nazer at Boston University, and Marnie shared with the community. And she showed that after treating her children for about 3 months with multiple cycles of treatment, her child that had the highest functioning clearly demonstrated a benefit on their best days. She was even rating her children, as well as in the worst days of the ASD symptomatology. And she was struck by how the reading fluency was improved, the empathy was improved, and how her child was coping with adversity better. But even the most severe child had improvements, both on his best days, the scores were lower after treatment, as well as in the worst days. And there were no aggressions, there were less anxiety, as reported by the mother, and greater capacity to adapt to situations like summer school without or with fewer behavioral problems. Interestingly, these were findings that were later on confirmed by a separate group in Cuba, in Havana, who went on just trying to explore the same question in children and adolescents. Can disruptive behavior, aberrant behaviors be better controlled with transcranial light? Their treatment was also a laser treatment, but this time a very low power treatment. And they also used a sham device. They randomized 1-to-1 about 40 children and adolescents in between 5 and 17. And they definitely showed significant benefits. The treatment is here depicted with a continuous line and the placebo with the dotted line at the aberrant behavior checklist. The benefits were definitely also on irritability and disruptive behaviors. But what they noted was that even other dimensions were improved beyond what they were targeting or beyond what they were expecting. In fact, there were improvement in social withdrawal, there were improvement in repetitive behaviors, there were improvement in hyperactivity and inappropriate speech. So these were striking results, which in a sense mimic the results that Attila Seronoglu at MGH found in adults, that there is a multidimensional effect of transcranial photobiomodulation with near-infrared light in ASD. Now, what about safety? Safety and long-term safety. We really don't have much experience in ASD, for children and adolescents in the long term. So I'm going to present some data from a different cohort, so different group of case reports on Down syndrome and transcranial photobiomodulation. About 4 years ago, again, I was quite struck when I received this email from a friend and colleague in Italy, Dr. Piero Mano, who had tried photobiomodulation in few of his Down syndrome children, and showed me an incredible progression of improvement in fine motor skills, which was paralleled by better behavioral control and mood regulation. So this child was asked to draw the portrait of her doctor. And here she was at the beginning of the baseline, and then 14 days later after treatment, then at 28 days, and then after 2 cycles. But this is not the only case. Another child was asked to draw this spiral, and this was before the treatment, and this is after the treatment. But this wasn't quite the reason for me to present you this data. The reason I'm presenting this data is because I just called Piero Mano again, and I asked him. I was actually driving home a few days ago from work, and I wanted to know more and see what happened all this time, and whether the treatment was safe, whether it was continuing or not. And after speaking with Piero, my jaw literally dropped and kind of locked there when I heard the things he had to say. Not only it was safe and no adverse event had occurred, but the cognitive function of these children had improved overall steadily. School performance had improved, socialization, speech flow, motor function, even their growth. They were slightly higher than their peers with Down syndrome. There were immunity likely benefits with less infections, and even the facial traits were less pronounced. That was astonishing. And most of all, what was interesting is that Dr. Mano had changed in the past year the schedule of treatment, which were 1 cycle of 4 weeks every 2 to 3 months, to 1 month of cycle, so 1 on and 1 off. And that was because the children themselves, or adolescents now, they were asking for it. They were noticing the difference. So overall, promising data in children and adolescents with ASD, and promising very early case report of long-term safety in children. So then, again, could we treat early? Could we prevent kind of the more complicated features? And could we allow children early on to have a quasi-normal development if we control some of these traits, or if we reduce some of these features? Well, this is potentially an option, given that this is a non-invasive device, non-ionizing, it's easy to use, there's great acceptability, low risk, natural, wearable, personalized potentially, but of course they're still unknown. So we took that question at MGH, and the Bressler Center for ASD is actually pioneering some studies with one goal in mind: to bring the treatment at home. We think that this is key to allow feasibility and also potentially scalability of this treatment. So Attila Seranoglu is pioneering a study in ASD in children, adolescents, and adults with at-home wearable devices. will start just at the beginning of 2021. And also another study in ADHD children and adolescents with autistic traits, also starting in 2021, and also at home, wearable device. And Mayu Uchida is pioneering a study in mood disorders in children and adolescents, also starting in 2021. So altogether, how can we get this done? And my thinking here, being myself a neuropsychopharmacology by training, and having working still in pharmacological trials led by pharma, being in academia as a researcher, and also now being an entrepreneur, I can tell that all these sectors need to pitch in. It's very important because we all have different skills. And I love the fact that Synchrony is bringing all together these different players to this conference. So my suggestion is that academia has great skills and brings proof of concept clinical trials, pilot clinical trials, early safety testing. Venture has the potential to create a new framework for strategic partnership across different groups and tailored investment funds. Pharma has great expertise in large clinical trials and scaling. And neurotech is on the verge of an exponential growth, because neurotech, more than any type of intervention, is paired to digital medicine. And so there is great potential to use machine learning, artificial intelligence, different sensors, and there's huge potential of personalization and much faster growth than pharma, who has a much longer times of development. Those predictive models that neurotech can develop, however, they are disease specific, so they can be used by pharma. And also neurotech, like photobiomodulation, can lead to extended patents over pharmacological interventions and new patents related to the augmentation. So there's a potential of great synergy among different groups. And I think partnership would likely lead to making this new treatment a reality. So again, partnership between academia, biotech, pharma, and venture. I think we can do it, and I'm hopeful that this conference might lead in this direction. Thank you. We need early treatments to change the course of this disease. Thank you.
Thank you, Paolo. That's amazing. Really terrific to hear that bringing all of these groups together, in fact, may bring about the changes that we know can be possible. So
thank you, Anita.
Terrific.
Thank you so much. Thank you for inviting me.
It's so exciting to see an academic who is also a clinician and also works in the field of biotech, really looking at all these possibilities and bringing them together. I mean, all of the things you were talking about in Down syndrome that 4 years later they're seeing, I see in my clinical practice as well.
I was wondering about it.
And arm length, growth in young kids that just all of a sudden in a 6-month period have just taken off. And speech and language, I think, is an area that we've seen many big changes as well. So all of this is very exciting.
Anita, we should be looking at growth hormone and wondering about, there must be a correlation.
Yes, very interesting. And I think one of the areas is the gut as well, and what we need to be doing, there. I mean, some of the talks earlier certainly were indicating that, but some of my correspondence with colleagues in Australia and looking at the microbiome and its influence on Parkinson's, and two different types of Parkinson's now, one with starting probably in the gut and one starting in the brain. So very exciting area, photobiomodulation, playing a role in. So I think we'll take one quick question, and I think you have answered it. It's really your hypothesis on safety of BPM with autism, but specifically with those children that experience either frontal or temporal lobe epilepsy. And do you feel that, photobiomodulation is still potentially safe?
Yes, I do think so. As a matter of fact, I cannot quote right now, but I recently seen information in the literature that photobiomodulation is not likely to increase the risk of seizure. But I can certainly, if people email me, I can certainly find those references and sort of make those available.
Okay, that's fantastic. I think that would be helpful. My experience in young infants as well as young children who experience epilepsy and doing transcranial therapy actually has resulted in decreasing the frequency and severity of their epilepsy. But again, this is anecdotal, and it would be very nice for us to be able to do some research to really show. And I think, whether we do pulse frequencies or continuous, I think all these things we need to really look at. So very exciting. Thank you.
And I see also Marnie. Marnie, you were instrumental in sharing those two early case reports that really inspired a lot of the field.
Yeah, they started out, I guess I have, okay. They started out with a default mode network. We didn't get into that, but that's really what they started out with. So, and Doug Johnson from Multiradiance and Medics, and Anita can talk about that. He has a lot of experience in the early days.
Yeah, very exciting.
Thank you. It is very exciting. I think you can work with them very young is a great idea.
And home treatment.
Home treatment.
Yes. I mean, I think if we are looking at a treatment that potentially has to be done, 2 or 3 times a week and on an ongoing basis, because I think regardless of what groups we've treated, the vast majority of them need ongoing treatment. And when we totally take that away, I too have kids who go, no, I need my, we had to take a light holiday. And shortly after that, it's like, I feel the difference. I want the light back again. So I think it's interesting how they can identify that.
One thing that Dr. Manu was emphasizing is that, even before the parents or the school teachers were noticing any change, the kids, adolescents were noticing somewhat the kind of their decrease in function or performance, and they were requesting. So they clearly can sense it.